first pipes that come off the aorta are actually ones that feed the heart and supply oxygen and blood to the heart itself. And these are called coronary arteries. And if you look at the diagram here where my mouse is, these are coronary arteries. There's one on the right side, and then there's two on the left. One kind of circumvents the whole heart called the left circumflex artery. And then there's a left anterior descending artery that goes from the left side of the heart all the way across the top of it to the tip. When you get a blockage in one of these, it can cut off the blood to the area that vessel is supplying, and then that area of heart muscle dies, and that's what we call a heart attack. Okay, well, what is coronary artery disease? These are some cross sections of your coronary arteries, and if you can see, there's multiple layers. On the left, the inner tube is called the intima layer, and that's where the blood flows. But the heart itself is surrounded by multiple layers. There's a muscle layer that allows the artery to open and close to increase flow or decrease flow when you're not using it. There's connective tissue layers, and then there's an external layer. And they all act in a dynamic fashion. It's a living, breathing organism itself. So when you're running or exercising, you're going to need more oxygen to your body and more blood. And these arteries can actually dilate and get more blood flow to all the organs. But over time, you can get fat buildup, and that's where you see the word plaque. The fat sneaks in behind the inner layer and starts to create a blockage. And when that blockage obstructs more than 70% of the diameter of your coronary arteries, it limits the blood flow and people get chest pain. If that artery pops open like a pimple, then those fat contents and everything else go inside the artery. Your body will overreact and think it's a foreign organism and try to kill it, and it tries to kill it by clotting it and suffocating it. But when it clots, it's just like the drain in your sink. It backs up. No blood flow can go past the blockage anymore. It cuts off the blood to your heart, and that's called a heart attack. So this is just another diagram of how this happens. So in the first decade of life in Japan after World War II, little babies that died in the war, they dissected their coronary arteries and they saw fatty streaks as young as 2 years old. So this fat sneaks between the layers on the inner layer, and they go behind the inner layer, and then they start to develop what we see on the way to the right, a big plaque. And then now you can see way to the right, after 40 years old, they start to obstruct the artery. When you go to a coronary cath lab, that's when we stick a little wire down here and we run a balloon and we smush the plaque, and then we can stick a stent, and a stent is like basically a chicken wire coop shaped in a straw that with a balloon stuck in the middle of it, and when we expand the balloon, the stent expands and the chain link fence stays open, trapping all the fat behind it and opening up the blood vessel. A bypass surgery is just what it sounds like. We take another artery that's really good and we hook it up to the aorta where all the blood's coming off of, and we connect it distal or after the blockage, so the blood flow bypasses the coronary artery that comes out of the aorta naturally, comes off at a different point in the aortic pipe, and goes distal to the blockage so the blood flow can still get down. Okay, are there any other organs that are affected by this process? And the answer is yes. So just like you have arteries that feed your heart, you have arteries that feed your brain called carotid arteries. And when they get blockages in them, it cuts off the oxygen tissue of your brain, and that is a stroke. In your legs, we have blood vessels that take pipes off the aorta, and they go down to each leg. And you could see that in the middle there. And when they have blockages in there, they cause what we call claudication, which just means you start to walk and your legs start to cramp up on you. And that can progress all the way to a full blockage, just like a heart attack. And that can be an emergency because you could lose your leg or your foot. On the right is the coronary arteries, which we've already discussed, how they can cause angina, which is the chest pain that I talked about, or a heart attack if the plaque ruptures. They can also cause, obviously, sudden cardiac death, and that usually happens when the artery is blocked. It can actually affect the rhythm of the heart, and it can make the heart stop pumping. How do you know if you have it? Are there any symptoms? Well, it turns out that you can have blockages developing for a long period of time with no symptoms at all. There are times then it could develop. If the plaque is stable and does not rupture, then it'll start to occlude the blood vessel, and people can complain of chest pain. And usually it's exertional chest pain. And that's when you exercise, walk, go upstairs, you start to get really short of breath, or you can get chest tightness. Myocardial infarction is the medical name for heart attack, and that can cause severe chest pain. They can cause death. They can cause irregular heartbeats, and those are medical emergencies. So what is the epidemiology of this? How big is heart disease? Well, it turns out that heart disease is still the #1 killer worldwide. Over 12 million deaths occur every year from heart attacks. Now, the fortunate thing is during the last 30 years, we've seen big declines in developed countries. We have cardiac cath labs, we have new medicines, our emergency teams, including from the ambulance all the way to the ERs, are prone to identifying it and instituting rapid steps to diagnose it and then institute treatment. And so we've gotten a lot better, and our medicines have gotten better. Our awareness has gotten better. Our screening has gotten better. Okay, well, why does this happen to you? We say, why me? Well, there's some things that people are doing themselves and some things you can't control. So there is a strong genetic predisposition. A lot of people have heart disease. Their mom has heart disease. Their dad had heart attacks or heart disease. Their grandparents do. Their siblings do. You can't pick your parents. So depending on your genetics, you might be at elevated risk for it. The other things that we have happen to us, sometimes diabetes can be acquired, or you could be born with diabetes. That's what we call type 1 or early onset diabetes or childhood diabetes. These are people who are born with defective organ called the pancreas, and the pancreas actually produces a hormone called insulin, and the insulin is a chemical signal that controls blood sugar levels. People who are born with a defective pancreas, they don't have these certain cells called beta cells that produce insulin, and these are usually childhood or early onset, and those kids have to take insulin. As we get older, though, you can acquire diabetes, and a big factor is obesity. Fat actually acts like a sponge and sucks the insulin out of our blood. So your pancreas is normal, it's producing insulin as it should, but then insulin is getting stolen by all of our fat around our stomach. So then our blood sugar starts to rise, which triggers a whole mechanism telling our pancreas that, hey, we don't have enough insulin. And so the pancreas goes into overdrive 24 hours a day, producing more and more insulin to try to counter the losses in the fat, and it burns itself out. And that's type 2 diabetes, and that can be treated many ways. High blood pressure, mostly if you live long enough, you'll develop high blood pressure. I know I talked about this in our last talk too, but you can use the age way to kind of define it. 40% of 40-year-olds have high blood pressure, 50% of 50-year-olds, 60% of 60-year-olds, 80% of 80-year-olds. So you can go all the way up. We'll develop high blood pressure. That high blood pressure also causes CAD or coronary disease. Okay. Also, environments cause problems. We're, especially in the US, in a highly developed country, we tend to live in cities. Urbanization, there's a lot of benefits of that. The downside of that is we're not running around trying to pick apples. We're going to drive through windows and picking up hamburgers. And we're going to the drive-through windows in our car. We're not walking there. We're not taking our bikes. A lot of our food is processed food that tends not to be as healthy as simple food that we used to eat. And changes in our lifestyle, like we said. This is a relatively rich country, and so most of us have cars. There's buses. Now you can get on your phone and call a cab to your house and Uber. We have planes. We don't really move as much. We have escalators and elevators. And so we have a lot of ways for us not to move. And we have a lot of ways for us to access cheap, fat food. Organic food, we had a farm when we were little. You just pick them for the backyard. Now that's like 10 times the cost of processed food. And bananas used to be really tiny, and now they're huge. And tomatoes were small, and now they're huge. And so all these things have affected our bodies. So what increases your risk? On the left, things you can't help. Like I said, if you're blessed to get older, the older you get, the more time all these things that we were just talking about have time to take effect to your body. Your sex, men tend to have a higher risk, although women have higher risks as well. It used to be that if a woman complained of chest pain, they would be misogynistic and say she's crazy and not, women can't have heart disease. But then after women started picking up smoking, the rates of heart disease approach that of men. Certain races have higher incidence of coronary disease. And then, like we talked about before, your family history, genetics, you can't control any of that. What can you control, though, is the stuff on the right. Your cholesterol, you can get screened, you can know your numbers, and we can get treated. Smoking, if you smoke, you can quit. We'll talk about that. Your blood pressure, being screened and being treated. Diabetes itself, through treatment, medicine, through exercise, through weight loss, and you can control your diabetes. If you don't control your diabetes, it acts like acid in your body and slowly just eats you from the inside out. If you control your diabetes well, then it won't be a problem for you. Obesity, unfortunately, America, because of all the things that we talked about, we're getting fatter. If you take your time after this talk and go on the internet and Google obesity chart in the USA, you'll see that probably half of our adults are overweight. Alcohol consumption, we'll talk about that. Does that affect you? What's a safe amount of alcohol? And then another factor is physical inactivity, that when you just don't move, that can be a big factor for you. Okay, cholesterol. Let's start going through those one by one, and we'll start with cholesterol. What is cholesterol? Well, you need cholesterol. Your body needs fat to absorb fat-soluble vitamins, A, B, A, D, E, and F. They're all fat-soluble vitamins that your body needs fat. In addition, the fat coats your neurons. So in your brain and everywhere else, you have neurons that just act like electrical cords. And if you take the plastic off electrical cords, I don't need to tell anybody here, you can have a short circuit. But in your brain, your body uses fat to cover those neurons so that they don't short circuit. Okay, fat itself gets circulated throughout your blood and goes to your organs where it needs. Why is cholesterol a problem? Well, when you have too much cholesterol, then it gets into mischief. And that's when those plaques start to build up, like we showed you before. And a lot of times you don't have any symptoms until people have a heart attack. All right, where does this cholesterol come from? Well, it comes from two sources. Your liver actually produces the fat. So 65% of your cholesterol in your body gets produced in your liver. And then 35% comes from your food you ingest. Okay, so when you get your blood test from your doctor, there's different labels and numbers of cholesterol, and we'll talk what they mean. Your LDL cholesterol is the bad one. And so I think of it as L. You want that as low as you can go. Okay, this is the bad cholesterol. This is the one that gets inside your arteries. This is the one that clogs up your arteries. Okay, you'll see another number on there called HDL. Okay, H, high. You want that as high as you can get. The higher the HDL, the better it is for you. And you can increase your HDL through exercise and diet. And your HDL actually acts like a cleaner. It goes behind LDL and cleans the fat out of your body. So it tries to protect you from LDL. It's your body's counterbalance to the bad LDL. Okay, now what about obesity? So we've talked about cholesterol. Let's talk about obesity. We consider you obese when you're 10 to 30% more than your ideal body weight. People who are obese have 2 to 6 times the risk of developing heart disease. The waist to hip ratio is important. You want a small waist to hip ratio. Women 0.85 and men 0.95. Now there's different shapes of bodies. We call them pears and apples, and this has to do with where your fat naturally goes. We have this so-called pear-shaped and apple body. So pear-shaped are people who store fat kind of on their hips and thighs and just below the skin. This tends to be not as bad for you for your heart. But people who are apple-shaped, you see this gentleman here with a big abdomen. that fat that goes all around your stomach, and unfortunately, men tend to put all their fat around their belly. This fat tends to be deeper. It's not just under your skin. It tends to be on the inside too, what we call visceral, and it wraps all your organs. And when it wraps all your organs, your blood has more access to that fat and it's able to get in your bloodstream and cause more damage. So apple-shaped bodies where your fat's all around your trunk and your stomach tend to be worse. Okay, so we talked about those. What about inactivity? Physical inactivity. This guy says, every morning my brain tells me to exercise and my body laughs at the idea. So exercise is not fun. Nobody likes to do it, but your body was designed for it to move. Cholesterol is fat is also a source of energy. It's a lot more highly dense than sugar, and your body uses it to store energy so that if we starve, like in the winter when, if the old days, if we're living in the forest and it was cold, you wouldn't be able to get as much food. And so just like bears do, they store a bunch of fat and they go in a cave and hibernate. Their body goes from eating sugar, and sugar, on a side note, is the first line that your body wants to use because sugar is very simple form and it's very easy for your body to convert the sugar into an energy called ATP that we use. Fat is a little bit more complex to break down, but it's highly dense with energy, and your body will only use that when you don't have any sugar in your body. Okay, cigarette smoking. Fortunately, there was a time where half of our adult population smoked. We've cut that down now to half, probably 22 to 24% of our adult population smoke. Smoking is bad for your heart and blood vessels. It increases blood pressure, and it decreases our friend HDL. Remember, HDL is the good cholesterol. H you want as high as you can get. HDL goes around your body and cleans out fat like liquid Drano, and cigarette smoking decreases it. Smoking itself causes inflammation, and it damages our arteries. And when the arteries are damaged, more fat can sneak inside there and cause more blockage. Smoking increases heart attacks. Cigarette smoke contains more than 4,000 chemicals, and 200 of these chemicals are poisonous. Okay, if you think you were smoking the cigarette, you're mistaken. It's the other way around, and you can see the cigarette's holding a box of humans. All right, what about alcohol? Well, they used to say one glass of wine may be heart beneficial to you. We've seen studies that if you drink grape juice, it's these flavonoid things that we call inside wine that comes from grapes, seems to be as good. We now have new studies that says no amount of alcohol is good for you. But, people drink, and if you drink, try to limit it to 1 to 2 drinks at a time. In large amounts, alcohol can make you fat, and we talked about obesity. It can also raise your blood pressure. If you drink more than 4 drinks a day, then you're starting to cause some damage. Okay. Now, diabetes itself. Well, diabetes is bad no matter what your cholesterol level is. People with diabetes have 2 to 3 times higher chances of having a heart attack or stroke. And as a matter of fact, a diabetic is more likely to die from a heart attack than a non-diabetic. 80% of diabetics will die from heart disease. The risk of sudden cardiac death and heart attacks in diabetics are the same as someone who already had a heart attack. So if I had a room, 50% of the people had diabetes but never had a heart attack, and the other half of the room had heart attacks before, everybody in that room is at the same level of risk of getting a heart attack. So diabetics have the same chance of getting a heart attack like someone who's already had a heart attack. And that's why when we get somebody with diabetes, we treat all their risk factors as if they already had a heart attack. What about the interactions of these risk factors? Well, it's very bad. So, and what I mean by that is the risk of heart disease, strokes, heart attacks, major adverse cardiac events is not just additive when you have multiple things, it's actually what we call multiplicative. So if you had a 1 increase a chance with blood pressure of having a heart attack, and a 1 chance for cholesterol, and a 1 chance for overweight, and a 1 chance for smoking, you would add those up and you would say that's a 4 chance higher. But it's actually higher than that. It's instead of just adding the risks, when they all come together, it's a multiplier of that. It's probably 5.5%. So it's an increased risk. We say it's like having a wick, a lighter, and dynamite. All by themselves, they're okay, but when you put them all together, they're bad. And that's true for all the risk factors. Okay. There's a wise proverb: misfortunes always come in by the door that is left open. So in other words, when you have these risk factors, we really need to address them and not allow ourselves to have damage and develop heart attacks and strokes. So we talked about things you can't change, but what are the choices that we do? Every day we're making choices that can protect ourselves and our family, okay? And we really want to protect ourselves from the #1 cause of death in America, heart disease. So they say, for my car, I want the best mechanic. But for my own body, I follow hearsay and advice from friends and kiddie parties and local quacks. Everybody with the internet has become a doctor. And we don't discourage it, but you have to realize that there's a lot of science behind heart disease, and you should find a physician that you trust and take their advice, and then look up stuff yourself. But when you try to form, a lot of people try to figure out things for themselves, and it could just be coincidence. Somebody might be drinking who knows what and tell you that I don't have any chest pain anymore. But when you put those in a big trial, sometimes they don't turn out to be true. Okay. Creative strategies that do not work. People never had a test or retest. They've never been to a doctor. They hate them. They don't take medicines. They're on medicine for blood pressure. Their blood pressure is normal now. They just stop the medicines, but those medicines don't fix it. They're just treating it. So if you stop them, your blood pressure goes up. If you stop your cholesterol medicine, your cholesterol goes up. All right. What about food in our diet? It's just very simple. You got to go back to the basics. You got to try to eat as many fruits and vegetables, at least 5 servings a day. You want to try to eat grain products. And when you eat fatty foods, if you have choices to either get non-fat or low-fat products, that's healthier for you. When you eat meats, you want to try to eat lean meats, chicken, and not our Wisconsin fish fry, although I love fish fries, but you just got to moderate it, and lean cuts of meat. And switch your milk. You can try to go fat-free or at least low-fat skim milk. A lot of people, including my own parents, they think that tastes like water, so they don't listen to me. But trust me, if you switch to lower fat foods, you get used to it. All right. You should limit your foods that are high in calorie. So you should look up calories of foods. If you go to a steakhouse and order a filet and French fries, and by the way, I love French fries, but I have to stay away from them. The fries have more calories than the filet. You could literally order 2 filet mignons and skip the fries, and you'd be better off. It's insane. I mean, when I saw that, I actually didn't even know that. I went to a restaurant and they had their menu and they had all their calories, and I saw the fries had more calories than my filet. And so I started looking that stuff up. So it's pretty eye-opening when you start to do it yourself. Okay, what about types of fats? There are so-called saturated fats and unsaturated fats, and we'll talk about those. So the saturated fats have to do with the way the molecule is structured. You don't need to remember this, but we'll talk about which ones are good and which ones are bad. But they get hydrated. They have hydrogen items on there. And when they get hydrated and they're saturated, they get really flat. Okay? But imagine you're trying to stack a bunch of papers. And if I crumble papers up and try to stack them, there's a lot of air in there and they're really fluffy because they're just crumbled up papers. But when you saturate the fats, they lay flat like a flat paper. Okay? Now you can just get a big stack of paper like you're going to put in your printer. That's really dense and heavy. So when you eat saturated fats, like animal fat, like the fat on a steak, or that stuff is very saturated, and it's just like stacking up thin pieces of paper. That's very bad for your body. We want fluffy fats that don't have as much hydrogen atoms so that they're fluffy. You should try to limit your salt as much as you can. There's salt in the food. Try to limit adding it, and then try, like we talked about before, not adding more than 1 to 2 drinks a night. Okay. What are fats that are rich in that bad saturated fat? Where when you eat eggs, the yellow part, the yolk. I'm not telling you not to eat them ever, but if you can, maybe eat a couple yolks, and then the other ones, make them egg whites. Fatty meat, especially organ meat like livers, they're rich in fat. Those are bad for you. Chicken, fried fish, a lot of cheese. I mean, we're from Wisconsin, so I think everybody who's listening to me is going to turn it off at this point because we all love this stuff, but you got to do it in moderation. Ice cream, Wisconsin, we didn't even think ice cream was good enough. We invented custard. We put more fat in the ice cream. Tastes good, but it's really not good for us. And then hidden fats that don't really taste fatty. All of our biscuits that we eat and cakes and pastries, you have to limit the portion sizes. There's a lot of countries in the world, France and Japan, they eat all this stuff. But if you go see their portions, they're, a quarter of what we eat. For my own self, if I go to a restaurant and I don't get a big portion, I feel like I got cheated. So that mentality has to change. So one technique is eat slower because your brain actually has to register the fat that came in or the food that comes in your mouth. If you eat too quick, your brain never really has a chance to register how much you ingested. So even if you eat a piece of chocolate, just stick it in your mouth and let it melt. Don't chew it and swallow it. There's signals that come from your taste buds that will go to your brain to an area called the satiety center in the side of your brain that tells you when you've had enough. If you just swallow the food without letting it melt in your mouth like candy or sweets, it'll go in your stomach and your brain will never register it, and you'll just want more and more. So those are little techniques to help you. So saturated fats we said are bad. Those are things like coconut oil, palm oil, and ghee, which is used in East Asia. It's really high of butter, certain type of butter that they put in there, but it's really bad for you. Mono unsaturated fats, these are fluffy fats. These are good for you. Olive oil is great for you. And believe it or not, canola oil. There's been studies that compared canola oil against olive oil, and people's cholesterol look better on canola oil even over olive oil. So those are good oils to use. Other ones, sunflower oil and soybean oil, tend to be a little bit more heart healthy than the coconuts. Okay. Omega-3 fatty acids, fish oil. We all like fish. Salmon, the greasy fish there. Those fish oils tend to also be heart healthy. Okay. Exercise. What about exercise? Inactivity is what's really hurting us. Okay. It turns out that if you add an additional 30 minutes of walking to your life a week, 30 minutes a week, that's like 5-6 minutes a day, you will decrease the chance of you having a heart attack, stroke, or dying by 14%. We try to get you to walk 30 minutes a day. You don't need to walk all 30 minutes, but if you can walk like 3 10 minutes, 6 5 minutes, 2 15 minutes, 120, 110, or 130 every day, imagine how much you can decrease your risk. No doctors, no medicine, nothing, just walking. Walking, we don't really have your HDL, remember that's our buddy. H stands for high. We want that high that clears out all your fat. We don't really have good medications to increase HDL. But guess what we do? Exercise. Exercise increases your HDL. So you'll increase that by walking. It also gets rid of bad fat. It lowers your LDL and lowers your cholesterol. You can actually cut your LDL, your bad cholesterol, by over 50% with diet and exercise. Unfortunately, that's called lifestyle modification, but it's hard to keep up. It helps when you walk, you actually burn sugar in your body, you improve your diabetes control, and walking decreases blood pressure. It's free. We would just all have to do it. Okay? If you're retired, there's a study that shows that if men walk 2 miles a day, they can cut the risk of death from heart disease in half. So people count the steps. Everybody's like, I walked 10,000 steps today. Every mile is about 2,000 steps. So if you're able to do about 4,000 steps a day, especially when you're retired, walking around the mall, walking around the neighborhood, you can decrease the chance of you dying from heart disease. Exercise. Moderate to intense physical activity, 30 to 45 minutes a day is what we recommend. Okay? And the guy on the bottom says, what fits your busy schedule better? Exercising an hour a day or being dead 24 hours a day? Kind of a stupid. All right. And we talked about it. You don't need to go to a gym. You don't need fancy equipment. You just need to walk as best you can. Now, a lot of us, you can have hip problems, you can have knee problems. It's difficult to walk. Some of our older patients are shy. They don't want to use a walker. But by using a walker, you can actually increase the time that you can walk in distance more safely. So I tell people, don't use a walker every day, but when you walk in your driveway, just go back and forth in your driveway. I tell some of my elderly patients, stick a chair, at the front and the end of the driveway and just walk back and forth. So when you get tired, you can sit down, or use a walker during that period so you can really walk. If you can't walk because your hips and knees, try a bicycle. If you can't do a bicycle, try to find a pool in your neighborhood. The pool takes all your weight off your joints, and you can just kind of leisurely walk back and forth. All that activity helps. Okay. Smoking. The risk of heart attacks decreases within the first 24 hours of quitting smoking. That's amazing. Even within a day, the heart risk goes down. And it's significantly within a couple years, you're at the level of someone who doesn't smoke. Your smell and taste improves. And the cough that smokers get has to do with these hairs that are in your esophagus. I mean, not esophagus, but trachea. And these little hairs clean the dust out of your windpipe. And when you smoke, they die. And all that dust kind of clogs up with your saliva and goes into your lung, and you cough, cough, cough. After several months, 3 months, those hairs grow back and the cough stops. So rule number 3, stop smoking. And you see this doctor here telling that person, I'm prescribing a patch to help you quit smoking, wear it over your mouth. So all these things lead on the left, what we've been talking about, your tobacco use, your diet, your physical activity, your alcohol consumption, they overlap and they add to all the diseases on the right. Cardiovascular disease, cancer, diabetes, chronic respiratory disorders, osteoporosis, your bones thinning out, oral health, bad gums, bad breath, and they can add to mental issues. So you can see by doing these things for your heart, you're also potentially helping all these other things that they can cause. Rule number 4, know your numbers. It turns out that cholesterol in America, half of the people with high cholesterol have ever been tested. Half of the people who are tested are treated, and half of those who are treated at goal. So not a very good number. Your cholesterol level here, it says desirable numbers, but that really depends on your risk profile. People who are on a high risk profile, 3 categories: people who have heart disease, like they have blockages already, they've had a heart attack, people who've had a stroke, and people who have diabetes. Those 3 categories, we want your LDL cholesterol less than 70 milligrams per deciliter. That says less than 100, but we want it less than 70. And the reason is we have trials that show that if we're able to get your LDL cholesterol less than 70 milligrams per deciliter using statins, we can help prevent the plaque from growing. We can also prevent major adverse cardiac events, meaning death, heart attack, stroke, rehospitalization. How beneficial is it? Well, every time you decrease your cholesterol by 10%, you can expect a 20 to 30% decline in your CHD, which is coronary heart disease deaths. Controlling your blood pressure. Remember, we talked about that. We have many medications that can control your blood pressure. In the old days, they would do bloodletting, cupping, all kinds of stuff, and none of it worked. But we want your blood pressure down. Now, this says optimal level 120 over 80 millimeters of mercury. None of us, I'm sure, who are listening are 20 years old. But it all depends on your risk factors. You have to set your goal with your physician and work towards that. Okay? By dieting, by exercising, by losing weight, by watching the salt in your diet, you can get off a lot of your medications. Controlling blood sugar. Remember, this is really important. Diabetes, just like we call blood pressure a silent killer, diabetes is a silent killer too. When the sugars are running so high in your body, it is acting like acid in your body. If you take your medications and you check your sugars regularly and work with your physicians or providers, you can control diabetes and you can protect yourself from it. So, don't get disheartened. Science, we've made significant progress. We've decreased the deaths from heart disease. We've increased people's ability to walk and live healthily. And you just got to do basic stuff. Try to eat healthy, try to walk regularly, watch your weight, Try to quit smoking. Smoking is tough, but you just got to, we call it never quit quitting. Most people will have to try to quit 9 times in their life before they're successful. If people quit cold turkey at the end of 12 months, 93% are back smoking, only 7% are not smoking. And so it's very difficult, but you just got to keep trying. Keeping your weight under control. All these things are things that we can do to help prevent us from developing and suffering from heart attacks. Okay, so don't wait for a heart attack. Act first. Okay, we're not like cats. Heart disease is often avoidable. Following a heart healthy lifestyle doesn't have to be complicated. We've made it kind of simple, and you just need to live a moderate life. Okay? All the things I told you not to eat or drink, you can eat them just in moderation. And that's it. So I appreciate all your time today. Hope it was beneficial. And if there are any questions, I'd be happy to take them.